Yeah, dear David, thank you for that nice introduction. Dear friends from the ITI network, it's a pleasure to share with you some of our ideas on narrow diameter implants. And you ask yourself, this is a maxillofacial surgeon. Why is he talking about narrow diameter implants? He should talk about bone grafting procedures. But I think there are many indications where we have narrow diameter implants in our mind. It starts already with the mesiodistal aspect. Let's say the simplest positioning rule, when we combine a premolar and a molar implant and we think, okay, this is a good indication for a narrow diameter implant. But the more interesting one, and we heard a lot about this one today, is the buccolingual aspect. We heard that there should be about 1 millimeter of natural bone, biologically valuable bone on the implant. Is this figure anyhow fixed? Does it come from the literature? So it's a questionable figure. We have in our clinical experience there should be enough bone on the implant, but the figure itself is unclear. But I think we all agree that bone around the implant is important. So that's the second step where narrow diameter implants might come into our mind. And when we think of the indication, which is the most challenging indication, where we would think, should we do a bone graft or should we do a narrow diameter implant? Of course, that is the lateral mandible. Here the bone augmentation procedures are sometimes more critical, and we have patients who say, a dental implant is fine for me, but bone grafting, no way. So these are follow-up cases where we already did with the standard implant a molar reconstruction, which is challenging and which is out of the indication. You have to talk about your patients about that.